All right, let's go ahead and get started. Good afternoon, everyone. Welcome to the 2021 Kansas Home Visiting Conference. We're so excited you're here with us. My name is Lydia Fuqua. I'll be the moderator for this session this afternoon. Just a couple of quick housekeeping items. This session is being recorded and it will be available on the conference platform 1 hour after the session ends. We definitely want to hear from you in the chat. Feel free to ask questions or comments in the chat box. Also, make sure to please keep yourself muted unless the presenter asks otherwise, and I believe there's going to be some opportunities for you to unmute yourself during this session. We have a wonderful lineup of speakers this afternoon and tomorrow, and we hope you're as excited as we are to dive right in. To get us started, I'm going to turn the session over to Morgan Hill with the Kansas Department of Health and Environment. Take it away, Morgan.
All right. Good afternoon, everybody. It is so amazing to see everyone in one space. I am actually the new program manager for the home visiting program with KDHE, and we have been putting together this conference. And as Lydia said, we are so excited to have everyone together. So I just wanted to start off by saying what a crazy year and a half it has been for everyone, and for home visiting especially. I know that home visitors and families have been incredibly resilient and tenacious, and you guys have gone above and beyond to do what is best for kids and families, and I just commend that. And we just got some statistics from the National Home Visiting Resource Center, which reported that the state of Kansas had 71,872 home visits in the year 2020, which is approximately 197 visits every single day of the year. And that includes 19,567 virtual visits. And that was with 10,078 children served. So I just want to say that even with all the craziness that was happening, you guys were getting out there and getting it done. And we absolutely are making huge strides in the safety and happiness and well-being of Kansas families. And one more just little tidbit here, you might have received some communication, possibly from KDHE, maybe someone else forwarded on to you. We do now have an ASQ, an Ages and Stages questionnaire online system. That is for all programs. We are, as everyone knows, kids' early life, their experiences absolutely affect their futures. And when we give these developmental screeners, we're able to address any potential concerns and connect families with what they need. So I'm going to drop in the chat just a link to some more information about this statewide ASQ online system. It's part of our All In for Kansas Kids initiative, and it's paid for by the Preschool Development Grant. So we are going to ask that providers continue to share that information so that we can continue to do what we can to make sure that we continue keeping Kansas families healthy, happy, and safe. And with that, I will turn it over to Amanda Peterson, who is the Director of Early Childhood with the Department of Education.
Thanks, Morgan. Good afternoon, everybody. I am here to echo what Morgan said. It is so nice to be with all of you, and it has been a real joy to get to hear about this virtual conference coming together. And gosh, you've got a really terrific lineup in terms of the professional learning that's ahead for the next couple of days. So thanks for taking the time to join. I want to say two things today. One, I think that any conference, whether it's virtual or in person, is a really nice chance to take a deep breath and get reconnected with our why and remember the great work that we do. And, for our team in particular, we've taken some time. In Kansas, we really do have our All In for Kansas Kids strategic plan that Morgan just referenced. That really does set the direction for where Kansans told us they want us to go and for where we want to go as a state. And so it might have been some time since you took a look at this. I'll drop a link to that in the chat as well. There's something really important in this plan, and that's that we in Kansas never even had to think twice about whether or not home visiting and parent education would be considered part of our early childhood system. In other states, they really had to go back and forth about this. And for us, you can look at, there's a cool infographic on page 9. There's definitions later on in the glossary. We knew that this is something that is critical and essential to our early childhood system. And so I hope that as you're flipping through this plan, as you're catching on to the exciting momentum that we have in the state, even in the midst of all of the challenges related to the pandemic, I really do hope that you see and feel how critically important you are to this work. The second piece that I want to say, and I know that I'm preaching to the choir here, but I think it's so important. to say that the work that you do every single day matters so much in terms of our ability to achieve our state's long-term goals, and also in the impact that you're able to make, in every single one of those 197 visits that happen every day, in every conversation that you have with a family, in every coaching opportunity you have with a team member, in every partnership that you build at the local level, in every time where you say, okay, I'm going to think of a synonym for the word pivot and I'm going to like it and it's going to be great. That work really does pay off in terms of just the impact that you make in the lives of kids and families and the professionals who partner with them and serve them. So really, thank you for the work that you do. And thank you for taking the time to join us for the next, for this conference, to be able to consider how we can continue to improve and do an even better job in serving kids and families in Kansas. So with that, I'll turn it back over to Lydia to introduce our very first keynote speaker.
Wonderful. Thank you so much, Amanda. I'm super excited to introduce this afternoon's keynote speaker, Dr. Joan Duvey. Dr. Duvey worked with the Kansas Department of Health and Environment as a consultant on COVID-19 response for 9 months before joining as the Deputy State Health Officer. She continues leading the state COVID-19 testing program and assisting with vaccine and health equity initiatives. Before moving to Kansas, she served as the Director of Public Health for the South Carolina Department of Health and Environmental Control. Prior to transitioning to full-time public health work, she practiced family medicine in Indiana for 11 years. Welcome, Dr. Duvey, and thanks so much for sharing with us today. I'll turn it over to you for some COVID myth busting.
Thank you so much, Lydia. And thanks everyone for asking me to be here today. Well, I think actually the invitation went to Dr. Norman, who couldn't do it. And so he said, do you mind doing this? And I honestly, the comment, get connected with your why. This is my why, right? Healthy kids, healthy families. That's what public health is. And, when we think about the future of Kansas, the future of the United States, the hope for our future is in our children. And so the work you guys do is incredibly important. It's formative. It is nation building. And so thank you so much, Dr. Norman, for not being able to come, and for you all for giving me this opportunity. I am going to share my screen. Let's see how well I do this. Can you all see that? All right.
We can see.
Now you can't see it. Okay, let's try this again. All right, I'm going to try to share it one more time. Now you can see it.
Perfect.
Good. Thank you. It used to be assumed that you could open a presentation to full screen once you had started sharing, but I think they've changed something and can't do that any longer. So we are going to talk about COVID-19 Mythbusters. And I do want to hear from you, because I imagine that you're going to have heard everything we talk about and then some. And with KDHE and the whole response to the COVID pandemic, we are doing a lot of work around communications. And the more we hear from you and the more we hear about what you're hearing on the ground, the better our communications campaigns and our messaging will be. So we will get started. I thought I would start with just a few slides talking about COVID-19. Now, this may be really, really elementary for most of you, but I never want to assume that people, have kind of done all the reading. You may have, but to level set here, we are just going to cover a few things about COVID-19 basics. So COVID-19 is really the coronavirus disease that was identified in 2019. It's an illness caused by a virus called SARS-CoV-2. And that stands for Severe Acute Respiratory Syndrome Coronavirus 2. That's a mouthful. That's why we shortened it to COVID-19. So this SARS-CoV-2 or COVID-19 is a new human coronavirus that has spread rapidly, as we've all lived throughout the world. And what's interesting about coronavirus is that there are actually hundreds of coronaviruses that scientists have identified, and only 7 of those currently can infect people, or we know can infect people. And in fact, before about 15 years ago, there were only 4 that we knew of. And since then, there have been 3 newly identified coronavirus illnesses that cause severe respiratory symptoms. And those are SARS, MERS, that's the one with the camels, and now COVID-19. The other 4 coronaviruses are pretty mild, causing cold or flu-like illnesses in people. But certainly we don't think about them as severe or deadly infections. There are all the other hundreds of coronaviruses cause illness in animals like cattle, camels, bats. And then there are coronaviruses that that are designed only to infect animals. They won't infect people. And those are canine and feline coronaviruses that your cats or dogs may actually get. And those are sort of more cold-like illnesses as well in animals. So how severe is COVID-19? And I think, again, you all know the answer to this. It can be very severe, leading to hospitalization, intubation, and death. And 219 million people around the world have been diagnosed with this COVID-19. More than 4.5 million people have died. And that's 688,000 people in the United States and more than 6,000 Kansans who have died from COVID-19. For those who have COVID-19 and who have maybe milder illness or don't end up being hospitalized, COVID-19 can still cause lasting health problems. And you've all heard about long COVID. And I think, we're not fully aware of why that is. If those will be lifelong, if some of them may be transient for a few months. We've certainly heard stories about people suffering from fatigue or having heart arrhythmias for several months and then feeling better. Or if they will persist indefinitely. But I think what we can all agree about is that really this is a disease that needs to be taken seriously. And this is a disease that we are still learning so much about. COVID-19 is really spread in 3 main ways. If we breathe in the air around an infected person who is exhaling small droplets or particles that contain the virus, and those small droplets or particles can actually remain suspended in the air for quite some time. So it is possible for an infected person to have been in an area, and for one of us to have followed that person into the area. And if there's enough virus, because the person has a significant infection and a significant viral load, then it is potential that those droplets could, as they land, could land on our eyes, our nose, or our mouth, and infect us. Really 1 or 2 droplets probably isn't going to cause a COVID-19 infection, but if the person was spewing a lot of virus while they were breathing or talking loudly, and a lot of virus, lands on us, that could cause an infection. And that, as we've seen with the Delta variant, is really of concern, how much virus is present in someone with Delta variant COVID-19, and how easily that transmits from one person to another. And this is even amplified if somebody coughs or sneezes or talks loudly or sings. My daughter is an opera singer, and she was finishing her master's degree last year. And they had to cancel all their performances because singers can cause super spreader events because they project so well. And when they project, so does their spit. And if they're infected, so would the COVID virus. And if you do touch an object that has virus on it, and then you scratch your eyes or your nose or your mouth, that could also transmit the virus. It's less likely, but it is a potential way to transmit the virus. So really important to make sure that if you're out and about, you take some hand sanitizer with you, clean your hands, wash them. Soap and water works really well to make sure before you touch your face that your hands are clean. So how can I prevent getting COVID-19 or spreading it to others? Well, the best and actually the easiest way is to get the free and safe COVID-19 vaccine. It's easy to find. You can go to vaccines.gov, you put in your location, you'll find vaccine administration sites for if you're Spanish speaking or you're working with people who speak Spanish, if that's your primary language. Vacunas.gov is the same site, but entirely presented in Spanish. And also, if you had Pfizer vaccine 6 months ago, you are now may now be eligible to get a booster shot. And we just launched that on Friday. Many of you probably heard the news. And I do believe that if you're doing home visiting and you are face-to-face with clients all day, that does make you eligible as somebody who's a frontline healthcare worker or a frontline worker. The other folks who are eligible are those who are over the age of 65 or who live in long-term care facilities, adults over the age of 18 who are at high risk for severe COVID due to an underlying medical condition such as heart disease or diabetes. And then those healthcare workers and frontline workers who are at high risk for getting COVID and because of the frequent potential for exposure at high risk for getting more severe disease. The more viral load you're exposed to, the more likely you are to have severe disease. So another way, in addition to getting vaccinated, or if for some rare reason you are unable to get vaccinated, know your COVID status, and that is get tested. And you can find a testing site on our website at knowbeforeyougoks.com. Again, you just put your location in and the map will direct you to a free testing site in your community. Now, not every county yet has access to free COVID-19 testing. That's one of the things we've been working on. I think we still have 20 counties perhaps to go. And those, as you can imagine, are the more rural and frontier counties. But we are working hard to make sure there's COVID testing, free COVID testing available in every county across the state. Another thing you can do is to, as much as possible, avoid going out into crowded spaces. Or if you do have to go into a crowded space, limit your time there and then stay home if you get sick. And when we say get sick, we know with COVID that sometimes those symptoms can mimic symptoms of other infections or even perhaps a migraine headache. So it's really hard to know. It's hard to know, I woke up with a headache this morning, could this be COVID? Or, gosh, I know I have some fall allergies, but they're seeming kind of bad this year. Could this be COVID? A cough, a sore throat, a headache, fatigue, chills, fever, those are probably the easier ones, but those perhaps milder symptoms could still be COVID. So if you feel like you're at risk, stay home, get a COVID test, get your answer before you go out again. If you are out and about, make sure you wear a mask that covers both your nose and your mouth. I can't tell you how often, I go into the grocery store and people are trying to do the right thing and they're wearing a mask and it's just below their nose. So not only is that not protecting everybody who's around them, it's not protecting them very well either. So make sure your mask is worn properly. Maintain 6 feet of distance between you and others if you're able. And I know that for school-aged children, we have decreased that distance to 3 feet and really are encouraging kids to wear masks and to stay cohorted in pods. But for the rest of us, the recommendation still stands: 6 feet of distance when you're able. If you're providing healthcare, if you have to be close to somebody, really make sure that you limit the amount of time if possible, and make sure that mask is on and protecting you. And wash your hands, as we've talked about, and avoid touching your eyes, nose, and mouth. So what are variants? You've talked about the Delta variant a little bit. We know with viruses, and this is pretty much all viruses, they constantly change through mutation. And there are new variants of viruses that are expected to occur. So there are pressures, environmental pressures. A virus wants to survive. And so a mutation, a minor change in a virus, like a change in how tightly it clings to your cell when you inhale it, or how it may change a target that your immune system used to recognize, so that your immune system gets a little bit confused and might not recognize it as quickly. So these mutations happen with all viruses, and we expect them. Sometimes they come and they go. We, with the COVID-19 virus, have heard about some variants, the Lambda variant, for example. It's been popping up occasionally in Texas. I think we saw it, and in some other states. And we know that the country where this first appeared, and I'm going to get the country wrong, so I'm not going to say it, but it's somewhere in Central or South America. It actually became the dominant variant. But here, it's just not gaining any traction. And we think that maybe because Delta got here first, and Delta is so much better at ramping up virus, the amount of virus in the person who has the infection, and that spreading to other people simply because the amount of virus is so much more than in the original version of COVID, that all you do is open your mouth and virus comes out. So we think that maybe Delta kind of sucked the air out of the room and didn't leave space for Lambda variant. So sometimes variants emerge and they disappear. We don't always know why. But other times, like we've seen with Delta, they persist. And all variants of the virus that cause COVID-19 are being tracked in the United States and globally, and we're watching them very, very closely. So we know what to expect. So we know what might be the next variant that's coming to the United States, and fingers crossed, hopefully there isn't another one. But we do expect them. The best way to slow the emergence of new variants, and this is what we can do, is to reduce the spread of infection by taking the measures we need to protect ourselves. And the best way to protect ourselves is to get that COVID-19 vaccine when it's available to us. And right now we know that there's plenty of COVID-19 vaccine available, and we are still prioritizing getting people vaccinated who have not yet started to get vaccinated or who haven't finished their series of 2 doses if they're getting an mRNA vaccine. The COVID-19 Delta variant causes more infections and spreads faster than earlier forms of the virus. And it seems to cause more severe illness than previous strains, particularly in unvaccinated people. We're seeing a lot of unvaccinated people landing in the hospital, in the emergency department, getting admitted to intensive care units. And this is particularly concerning because we have seen more pediatric hospitalizations and intensive care unit stays with Delta variant than we ever saw throughout our 1.5 year experience with COVID-19. So more kids being hospitalized and getting severely ill with Delta variant. Vaccines, if you're eligible for a vaccine, and we know that people under the age of 12 aren't, reduce a person's risk of contracting the virus that causes COVID-19, including this variant. and they're highly effective at preventing hospitalization and death. So although some people who are vaccinated will end up in the hospital, what we know about those hospitalizations is that these are individuals who, for some reason, didn't have a robust response to their original vaccine series. So those individuals who are perhaps immunocompromised, who didn't make enough antibodies when they got vaccinated to fight off a COVID-19 infection. And those are the people who are targeted by the third dose of vaccine. Those folks with moderate to severe immunocompromising conditions who perhaps didn't respond to the initial series of vaccine, get them a third dose. So their series is now 3 doses, 2 doses that just like the rest of us, and then that third dose 4 weeks after the second dose. So they'll have a 3-dose series. And we're hoping that this will help prevent those individuals from needing hospitalization and, God forbid, from dying with this variant and with variants that we may see in the future. Fully vaccinated people with breakthrough infections who have responded to their vaccine series appear to be infectious for a shorter period of time. They do tend to have enough virus that they can spread the disease, but their immune system kicks in very quickly and starts to clean up that virus. And so they can spread COVID-19, but only for a short period of time. So again, a benefit to being vaccinated. If you do get breakthrough infection, hopefully your infection will be, it won't last as long, you won't get as sick, you won't end up in the hospital, and you won't die. So get vaccinated, wear masks indoors in public spaces, so that we can reduce the spread of this dangerous variant, especially to kids. So how are we doing with vaccination in Kansas? When we look at the total population, we finally hit the 50% mark of being fully vaccinated, and nearly 60% of Kansans have had 1 dose of vaccine. But when we look at only those people for whom there is a vaccine, those who are 12 and older, 60% are fully vaccinated. And that's pretty good news. We'd like to see that higher, but we all celebrated when we got to 60%. And 70% or more have had 1 or more doses. What we know about the eligible population 12 is that adults are doing well. They continue to get vaccinated. But those youth, 12 to 17, in particular 12 through 16, aren't doing as well. They continue to lag behind national averages. And so if you're working in families and there are children in families who, can get the vaccine, but haven't, it might be a good opportunity just to have a conversation with the parents, with mom, with dad, and ask what's holding you back, especially if there's a young child in the house who can't be vaccinated. We really rely on the entire family being vaccinated to cocoon or surround those who can't be vaccinated with protection, so that we don't bring COVID into the house and spread it to those younger kids who now we're seeing are getting sicker than they had previously. And just some trend lines so that you can see our daily cases. We have seen a little bit of a decline. We're holding our breath to see if this will be sustained and if the curve starts to really bend down. Deaths did hit a new high, but we know that deaths are a lagging indicator. Our deaths will continue to increase even after our cases decrease, because people have been in the hospital on ventilators for weeks or even a month or more. We've had testing increased as cases have increased. You see that little dip, but our data week over week showed that last week we did have an increase in testing. And it's vaccinations where we're just, having a tough time picking up speed. So again, that vaccine is the easiest thing we can do. It's the best thing we can do to climb out of this abyss. So now let's talk a little bit about fact versus fiction. Our COVID-19 vaccines, I can't see the top of my slide, oops, sorry. Are COVID-19 vaccines safe because they were developed so quickly? And the answer is yes, they are safe. We know that scientists have been working for years to develop mRNA vaccines. mRNA vaccines are actually faster to make than other types of vaccines. When you think about flu vaccine, where you have to grow flu virus in chicken eggs and harvest it and purify it, with mRNA vaccines, you choose a target on the virus. So you're not having to replicate the entire virus, but you choose a target that is effective at creating an immune target. So your immune system can find this target and attack the virus. And so it's one little piece of mRNA, and you put it into the vaccine, and you can change it quickly if you need to, if there are other variants that perhaps maybe evade the response from the vaccines we have now. Easy to change. So it's really great vaccine technology, which scientists have been working on for years, more than a decade, actually. So this is not new, even though it's new to us. And all vaccines in the United States have to go through 3 phases of clinical trials: safety and efficacy trials, and then trials to look for side effects that may not be picked up in the first 2 trials, because the size of those trials are smaller, so then larger population level trials. And these vaccines, the same thing, they went through 3 phases of clinical trials. What happened with the COVID-19 vaccine is that because this, we wanted this vaccine to be developed as quickly as possible, we didn't skip the phases, but some of the phases they overlapped so that the process could be sped up. So safety and efficacy trials done at the same time, for example, so that we could get to the population level trials, which are the larger trials. And the other thing that happened to speed up this process was that before the vaccines were even, the studies were finished and the vaccines were approved, the federal government said to the vaccine manufacturers, we're going to front you the money. We're going to pay for you to manufacture these vaccines because we believe in them, because we know scientists have been working to develop these vaccines for years. We are going to give you the money. We want you to do mass production so that as soon as we get the green light, we don't have to wait for you guys to make enough vaccine to start vaccinating our public. So that was the third thing that happened at the same time. And the federal government said, if it doesn't work, we're willing to waste this. But if it does work, we're going to be ahead of the game. And then the final step, and this is a step that every drug that gets approved must go through, and that's the FDA assessment of the data that gets submitted from the trials. And again, all 3 parts of those clinical trials. And then the FDA has to authorize use of the vaccine. And so, yes, we know that the COVID vaccine is safe and it's effective. Do COVID-19 vaccines contain microchips? I've heard this one quite a bit. And no, they don't contain microchips. What we know about COVID vaccines is that they fight against disease. Vaccines work by stimulating your immune system to make antibodies, just like it would if you actually had the disease. After getting vaccinated, you develop immunity to the disease without having to get that disease first. And, we give these vaccines to kids all the time, so they don't have to get chickenpox, so they don't have to get measles. And I don't know if any of you, have ever chipped a dog, but it hurts like crazy. And I can attest that there was no microchip in the vaccine that I got because I barely felt it as it was being administered. Can receiving a COVID vaccine cause you to be magnetic? And no, getting a COVID-19 vaccine will not make you magnetic, including at the side of your arm, which is usually where you get the vaccine. COVID-19 vaccines don't contain any ingredients that can produce an electromagnetic field. Electricity can produce an electromagnetic field. There's electricity in a COVID-19 vaccine. And they don't contain any metals. There's no zinc, no mercury, no metals at all in COVID-19 vaccines. So they will not make you magnetic. Will a COVID-19 vaccine alter my DNA? No. COVID-19 vaccines do not change or interact with your DNA in any way. Both the mRNA vaccines, that's the Moderna and the Pfizer, and viral vector COVID-19 vaccines, or like J&J, they deliver instructions to our cells so that our cells can start building protection against the virus that causes COVID-19. And then poof, they're gone. Once the cells learn, the instructions go away and the cells remember. And so the cells remember how to build those antibodies, and they teach other cells how to do it. But there's nothing that happens in your DNA. The DNA is in the nucleus of the cell, and the mRNA vaccines, these instructions never enter the nucleus of the cell. There's no mixing. Will I be able to have a baby if I get the COVID-19 vaccine? Yes, and plenty of women have gotten the vaccine and become pregnant and had babies. There were women who got pregnant during the clinical trials, and they were monitored very, very carefully and had healthy babies. COVID-19 vaccination is recommended for everyone 12 years of age and older, including people who are trying to get pregnant now or might become pregnant in the future, as well as in order to cocoon that baby once that baby's born, as well as their partners. So COVID-19 vaccination
Okay, folks, I think Dr. Duvey is frozen. Give us just a minute here. Let's see here. Stand by while we get Dr. Duvey back up and running.
Hello, I'm sorry, I'm back.
Oh, that's okay. We can hear you now.
Okay, did I lose you? I'm so sorry. I don't know.
Yes,
right.
Just briefly.
Let me go back. Okay. And let's see if I can, there we go. From current, let's see. Now, let's share again. There we are. Okay. So, so there is evidence that that moms who do get the vaccine during pregnancy actually pass that protection to their baby, to protect their baby, and, you know, for at least the first 3 months to 6 months of life. Similar to what we do with pertussis vaccine when we vaccinate pregnant women, or to flu vaccine when we vaccinate pregnant women. So good news for babies if mom is vaccinated. Can being near someone with COVID-19 affect my menstrual cycle? Nope. Your menstrual cycle cannot be affected by being near someone who received a COVID-19 vaccine. Your menstrual cycle very well could be affected by the stress of living through a pandemic. Changes in your schedule, worry, stress, problems with sleep. If we change our diet or our exercise, and I don't know about you guys, but all of that has changed for me during COVID-19. I'm not still menstruating, but everything else is there, stress and changes. So that might be happening, but it's not a result of being vaccinated. Also, if you get an infection, that may also affect your menstrual cycle. So women who do get COVID-19 and have high fevers, or just feeling really sick, that can delay their menstrual cycle. Can a COVID-19 vaccine make me sick with COVID-19? And the answer is no. None of the COVID-19 vaccines available in the US contain live COVID-19 virus. What the vaccines do is teach our immune systems how to recognize and how to fight the virus that causes COVID-19. And that battle, if you will, teaching the immune system to respond to COVID-19 can sometimes cause symptoms such as a fever, maybe a headache. These symptoms are typically short-lived and are a sign that your body is building that protection that it needs against the virus that causes COVID-19. Will getting a COVID-19 vaccine cause me to test positive for COVID on a viral test? And the answer is no. Viral tests are used to see if you have a current infection. These are the PCR tests, the one that we call the brain biopsy, which not too many people, I hope, are still doing, but maybe some are, saliva tests, or tests that are just at the entrance to your nose. None of the authorized COVID-19 vaccines will cause you to test positive on one of those viral tests. Antigen tests are also viral tests, the ones that you can buy over the counter, to tell you if you do have an infection. You won't test positive on those if you've had the vaccine. Oops, sorry. If your body develops an immune response to vaccination, you may test positive on some antibody tests. Not many, but the antibody tests that look for the same targets that the vaccine has caused your immune system to fight against, you may test positive on those antibody tests. Not too many people are getting antibody tests. Those tests indicate that you may have had a previous infection and you may have some protection against the virus, but they're not tests that you would get if you think you have an infection now. Do I still need to get COVID-19 vaccine if I had COVID-19 disease? The answer here is a big resounding yes. Yes, you should be vaccinated regardless of whether you already had COVID-19. Research hasn't shown us yet how long you're protected after you recover from COVID-19, but the Pfizer studies seem to suggest that, that the vaccine may wane over time. And we know that vaccine actually protects people better than people who get COVID-19 who have not been vaccinated. In fact, a study in Kentucky showed that unvaccinated people who already had COVID-19 are it's actually about 2.4 times as likely than fully vaccinated people to get another COVID-19 infection. So these are people unvaccinated and vaccinated, and both of them have already had COVID. But one group has been vaccinated. The ones who were not vaccinated are more than 2 times at risk for getting COVID-19 again. So the good news is if you get vaccinated, you can reduce your risk. Can children get seriously ill if they get COVID-19 infection? And we know now that the answer to this is yes. Children can be infected and get sick with the virus that causes COVID-19. Most kids, thankfully, have mild symptoms, or maybe they don't have any symptoms at all and are asymptomatic. Babies younger than 1 and children with other medical conditions are more likely to get seriously ill from COVID-19. And we also know now that Delta variant is causing more severe illness in children. In addition, some children get a rare but serious disease called multisystem inflammatory syndrome. And this often occurs or appears sometime after the initial infection. So it may be delayed by weeks or even a month. And then children have a severe inflammatory autoimmune syndrome, similar to an autoimmune syndrome. And they can be treated for this, but it is very, very serious and requires hospitalization in most cases. Is there anything we can do to keep our children safe from COVID-19? Yep. Until vaccination of kids, the things that we can do as adults are get vaccinated. Vaccination reduces the risk of infection among those youth who are eligible for vaccine, and it reduces the risk of exposure for those kids who are too young to be vaccinated when everybody in their orbit is already vaccinated. Testing with contact tracing can help identify kids that do have COVID-19 and help prevent the ongoing spread of disease to other children in a classroom, in a home setting, and also to their families. And this is really important to try to really cocoon those kids who can't be vaccinated, but also to cocoon our elderly who maybe are vaccinated but didn't respond as well to the vaccine as the rest of us did. And then masking and social distancing, these reduce the chance of spreading COVID-19 to people who are vaccinated and unvaccinated kids and adults who care for them and who love them. So with Delta, anybody is at risk of getting Delta and spreading disease, even if you're vaccinated. Put that mask back on, maintain social distance as much as you can, and will reduce the chance of spreading COVID-19. So I had to put the Swiss cheese theory in here because there are so many ways we can layer protection to keep our families safe, to keep our clients safe, to keep each other safe. And we've talked about a lot of them: avoiding those large gatherings, being outside where there's lots of air, there's lots of room, really decreases your risk of infection significantly as long as you're not in a crowd. Wash your hands, avoid touching your face, keep your distance, wear your mask over your mouth and your nose. Get tested regularly if you're out working with clients. If you're out and about, just get that test, even if you don't have symptoms. Stay in well-ventilated areas. So if you're in a home with somebody, open a window. It's hard when it's almost 100 degrees outside, but opening a window and using a fan to circulate the air will be helpful. And then if you are sick, you want to isolate, quarantine if you're exposed. And finally, vaccination, that's the linchpin. So the more protections we layer, the safer we'll all be. And finally, be a trusted messenger to change hearts and minds. Approach conversations with families with openness. And I always recommend listening first. What's keeping you from getting vaccinated? Be interested and be open. Meet the other person where they are and then acknowledge their position. I've heard others express those concerns too. Ask if they're interested in hearing what you've just learned. Don't assume they are. Don't preach, but ask Hey, I've just attended a meeting and learned some interesting things about COVID-19. Is it okay if I share them with you? Accept the person's response, but leave the door open. Thank you for sharing with me. I'm here for you if you want to talk again, if they just won't budge. Or if they are interested, thank you for sharing with me. How can I help you get that vaccine? Let me know how I can help. And so now is where, I don't know how much time we have because I always talk too much, but what myths have you heard? What have you learned talking, being out in the community, listening to people, talking with people? What things that I haven't mentioned? And I think you can unmute yourself. And I am going to stop sharing so I can see you. Or you can also put things in the chat box. Or any other questions?
I have a
I had a question.
Sure.
That said that.
Yeah, go ahead.
Okay, sorry.
Okay.
I do have a question. So if someone has tested positive for COVID already and they've had COVID, are they still, if they retest again, like you said, if they're asymptomatic and we're home visitors and we're going back into the homes, and so if we retest again after so many months of being positive, are you still positive or should it be negative? How does that work?
Yeah, so it depends on what type of test you're using. So the PCR tests, those are the ones that we consider the gold standard. And those are the ones that have to go to the lab typically, and it takes about a day or two to get the results back. Those are really, really, really sensitive, right? And they look for any little piece of that COVID-19 virus. And so if you get COVID and you're feeling better and you're out of your isolation, and you get tested again, and let's say it's like 6 months later, that test should probably be negative if you're not positive. But if it's 6 weeks later, it could be that your immune system is still working to clean up the bits and pieces of COVID left behind in your lungs and everywhere else in your body. And so there may be a false positive test. What we encourage you to do is to use an antigen test. So a Buy an X Now test, an over-the-counter antigen test, or you can get antigen tests at some of our free testing locations, because the antigen test looks for the actual virus itself. And it'll show you if you do have live virus.
Okay.
Yeah. And if that's negative and you don't have symptoms, then you are good to go.
Okay. Perfect. Thank you for clearing that up for me.
You're welcome. Let's see. I don't know who went next, so I'm just going to go in the order I can see you, and I apologize if I put somebody before somebody else. Shelley Crawford.
Hello. Yes. So I actually had a question in regard to quarantine times. If you could give kind of a brief overview of that. I know that it differs depending on if the person has been vaccinated or not. Can you kind of give some clarification into what that might look like for somebody who has been exposed?
Yeah, that's a great question. So for somebody who's vaccinated and is a close contact, you don't need to quarantine. You unless you're a healthcare provider. And so for home visitors, I wish I could tell you if that would apply to you or not, but it definitely applies to like people who work in hospital settings. So I'm going to need to ask about that and get back to you, Shelley. But in general, if you're vaccinated and you're a close contact, you don't need to quarantine. You just need to wear a mask. And then you get tested. You get tested around day 5, and then you get tested again between day 7 and 10. And just to make sure, because we know that you could be contagious, but not symptomatic. But most people, except for healthcare personnel, don't need to quarantine. And I'm going to get the answer about the healthcare personnel for the home visitors, if you qualify for that or not. If you aren't vaccinated, you need to quarantine. You need to be home. And there are different scenarios. And much of this will depend on what your county health department actually says you need to do. So the three options, according to the CDC, are you can do a shortened quarantine, and you would need a PCR test between day 5 and 7. And if that's negative on day 8, you can stop your quarantine. That's the shortened quarantine. Then there's the abbreviated quarantine, which means that after day 10, if you still don't have any symptoms, no fever, nothing, you don't need to test. You can just stop your quarantine. But the original quarantine, as we all know, is 14 days. And there are some folks for whom 14 days is still the standard. So it just really depends on your local health department and kind of what their recommendation is. But those are the options. Okay, somebody else was next.
Yeah,
And,
Dr. Duvey, it was Tiffany. She's had
Oh,
her
yeah.
hand up for a moment.
Yeah, there you go, Tiffany. Thank you. Tiffany, you're muted.
Extremely premature baby. He's just over a pound, and they asked out if one of the vaccines was better than another to keep their baby safe. I should think of a reason, but
So all I heard was somebody asked if one vaccine was better than another. I didn't hear the rest. Was it a particular? Was there a reason that question was asked? Well, so is one vaccine better than another? Well, if you're 16, the Pfizer vaccine is the best vaccine because it's the only one you can get. Pfizer has tended to have their data submitted to the CDC or to the FDA and also the CDC Advisory Committee before everyone else. We have a lot of experience around the Pfizer vaccine. It's a great vaccine. Recently, there's been some research that shows that the Moderna vaccine may actually persist, that the immunity may persist a little bit longer than the Pfizer vaccine. But we still don't know sort of if that's in certain people or in everybody. We're still waiting to hear kind of what their data show, and the FDA is reviewing that now, I believe. So both the Pfizer and the Moderna vaccine are really good vaccines. The J&J vaccine is also a very good vaccine, but we didn't start using the J&J vaccine until the spring, and so we have less experience with that vaccine, and fewer people have received it. So there's just not the quantity of data surrounding the vaccine. What we do know is that for some people, you got one shot to get them vaccinated, and they're not going back for another one. If you can find a J&J vaccine, do it. So we do expect that both the Moderna vaccine and the J&J vaccine will need boosters. So if you're looking for a vaccine that's going to get you off the booster bandwagon, you're probably out of luck. But the best vaccine is the one that's in your arm.
Thank you, Dr. Duvey. We have time for just a couple more questions. It looks like Onita Templeton has her hand raised, and then we have a question in the Pathable chat. So I'll let Onita ask her question, then I'll read you the last question.
Okay, perfect.
Thank you. Thank you, Dr. Duvey. I know it's really hard to keep up on all of this and provide information in a concise, succinct way, and I appreciate so much your trying. I heard you say that vaccinated people have a shorter transmission period. I wonder if you could comment on what I've heard about vaccinated people only being communicable when they're symptomatic and not doing asymptomatic transmission. Do you have any information about that?
Yeah, I don't believe that's correct.
Okay.
So the thing with the Delta variant is that even asymptomatic people have really, really high viral loads. So that may have been mostly true with previous variants, right? That didn't create as much virus. I mean, there's 10,000 times more virus available with the Delta variant in a person's nose and throat than there were with previous COVID-19 infections variants. So with that much virus, right, even if you're early in infection and even if you don't have symptoms, you can be infectious and spread to somebody else, which is why the CDC came back and said, okay, guys, you know what? We told you if you're vaccinated, you could take those masks off. Now got to put them back on. And I never leave my house without my mask. I get tested as often as I can. And I do still worry. I still worry about that Delta variant, about how infectious it is, how contagious it is. And, you know, I know that I could get it, so I try to protect myself. But the last thing in the world I would want would be to transmit it to somebody else, especially somebody who can't yet be vaccinated or somebody who hasn't responded to the vaccine.
Thank you for that.
You're welcome.
All right. Thank you so much, Dr. Doobie. We're actually 2 minutes over. There
Okay.
are a couple of questions in the chat that I'll make sure you get so that we can get those folks the answer to those questions. So if you didn't get your question answered, no worries. We'll make sure that we're able to connect you with the answer that Dr. Doobie has for you. But we want to thank you so much for joining us here this afternoon. We really appreciate all the information that you had to share with us and give you a virtual round of applause for your time this afternoon. Thank you, Dr.
Oh.
Doobie.
Thank you. It was my pleasure. Have a great conference.
Thank you. All right, we are now on to our break. Our first round of breakout sessions begins at 1:45. So you'll want to head back to the conference platform, that Pathable website, to pick your breakout session, and we'll see you back at 1:45. Thanks, everybody.